De qual céu mais você vem?
Hi, this is John Kanellopoulos. It's really a pleasure to share with you some of the work that we've been doing in Greece. I'm sorry I couldn't be with you in Barcelona to join my friend Pedro Grimaldos. It's very exciting, customized laser treatment for myopia. We all know that all laser platforms give excellent results in treating myopia today. We'll try and see our study, which is quite difficult to perform. We did 60 patients, one eye ray tracing LASIK, and this for myopia, and the other eye with Smile Pro, using two individual technologies, two different philosophies, in order to compare these brilliant techniques side by side. This presentation was given for the first time at the American Academy of Ophthalmology, and we were very honored for it to be included in the official press release of the Academy as one of the 10 most exemplified and newsworthy presentations in this meeting in 2025 in Orlando, Florida. These are my financial disclosures, and I do consult both for Alcon and Zeiss. And let's go look a little bit to summarize. Ray tracing is a technique that's not wavefront guided, that's not topo guided. It's performed with the proprietary software by Alcon. It used to be called Innovise. It is currently trade named as WaveLight Plus, and it uses one diagnostic device that obtains wavefront maps, pentacams, and actual length measurements to calculate the lower aberrations, myopia and astigmatism, and higher aberrations, transfer them to the X500 excimer laser, and while you're performing LASIK, femtosecond laser assisted LASIK, to treat the lower aberrations, higher aberrations automatically without any nomogram on all cases. We report on this extensively. And the other eye was treated with Smile Pro using the VisuMax 800 femtosecond laser. We've had the experience with over 2 years with this brilliant technology as well. But for the treatment, we use the myopic numbers, myopia and astigmatism, from the ray tracing calculation. So one eye was randomized to have ray tracing LASIK, and the other eye was randomized to have Smile Pro using the ray tracing calculated amount of myopia and astigmatism. There are several studies that compare the two techniques that show that LASIK may be more customizable, but never before was there a head-to-head comparison and contralateral eye comparing ray tracing LASIK to Smile Pro. And again, as I mentioned before, 60 patients, flip coin, randomized which eye would have a ray tracing LASIK, which eye would have Smile Pro. We looked at these at 3 months, and we tried to simulate whether some of the theoretical advantages of ray tracing were real in clinical evidence. And we're going to go look in some of these data. These are the preoperative and postoperative data. Preoperative, the average cornea pachymetry, especially as far as the epithelium, was measured 53 microns in the LASIK group, 53 microns in the Smile group. There's no reason for them to be different. At 1 month, again, there were no differences. At 3 months, again, no differences in the cornea epithelium, the average cornea epithelium of the LASIK eyes versus the Smile eyes. Now, if you look at the aberrations, there's a significant advantage in the ray tracing eyes, as the post-op aberrations at 3 months, as you can see on the bottom right image, were just 0.2 microns, were almost 0.2 and a half. This was a statistically significant difference, and it was mainly due to coma and not as much spherical aberrations. And again, these are on the left-hand side, all the parameters we evaluated: uncorrected visual acuity, corrected visual acuity, refractive error, cornea, tomography, spherical equivalent, defocus equivalent, higher aberrations in lieu of RMS total, and spherical aberration and contrastivity. Let's go to the next slide, which is more practical. We're seeing two eyes of the same patient, the preoperative contrastivity in the middle, and the preoperative higher aberrations under the pentacam maps. And we can see on the top the epithelial maps. And we're going to see that same patient treated here, the right eye, which is on the left, with ray tracing LASIK, and the left eye that's on the right with Smile Pro. And we can see that both results are exceptional. He is over 20/20 in both eyes, reached almost the 20/10 level out of both eyes. And when we look at the higher aberrations between the two eyes, which are the images under the Pentacam maps, we can see there's a slight difference between the two, with a little bit high or aberrations being on the higher side than the LASIK eyes and the SMILE eyes. When we look at contrastivity, in the middle, both eyes are almost the same. There's a small difference in the 12 and 18 cycles per degree for the SMILE eyes. But in essence, both procedures proved excellent. We can see the refractive error. It's over 3 diopters with over adoptive astigmatism with both eyes. So after seeing this clinical example, we'll see the cumulative data on this group. We can see on the top the uncorrected distance visual acuity, which showed that the ray tracing eyes gained more lines of vision. We had more lines of vision on the 2012 level and more on the 2010 level. The ray tracing eyes are the blue, the SMILE Pro eyes are the red, but all patients had at least 20/20 vision. We can see on the top right the uncorrected distance visual acuity versus corrected distance visual acuity between the two groups. We can see the change in corrected distance visual acuity, more changes in the blue columns, which are the ray tracing eyes. From more eyes gained lines of vision, meaning comparing pre-op best corrected to post-op uncorrected. We can see the spherical equivalent refraction plot of attempted versus achieved for both procedures was excellent all the way to the highest treatments. We can see the spherical equivalent refraction accuracy, that's the graph E, which was excellent as well, and the refractive astigmatism, which was of course much better for the LASIK eyes. And of course all these are compiled in a manuscript and we'll soon see it published. But in summary, as we can see here, the ray tracing LASIK and SMILE Pro appear to be both excellent in correcting myopic refractive error. The 3-month comparison of the two techniques in a prospective randomized contralateral eye study of myopic correction demonstrated, as I said before, excellent efficacy and safety for both techniques. But ray tracing LASIK, Wavelight Plus technique as it is called in the outcome terms, in this contralateral eye study appeared to offer superior visual outcomes in lines of vision gained compared to the SMILE eyes, while demonstrating difference in the focus equivalence accuracy. The focus equivalence is the summary of absolute residual sphere added to absolute cylinder spherical value. Less impact on the mesopic and scotopic contrastivity with the ray tracing eyes, and respective higher aberrations being lower on the ray tracing eyes than the SMILE eyes. And we can see on the bottom image again, the sitemap imaging a patient who have Wavelight Plus LASIK 3 months later, and you can see that yellow image is the higher aberrations, which are almost zero, something very rare with refractive surgery. On the top right, we can see in the green line the contrastivity for the ray tracing LASIK eyes, and the blue line the cumulative contrastivity for the SMILE eyes. And LASIK eyes again outperform slightly the SMILE eyes here.